There's a strange thing about confidence. It can sound like truth, it can look like certainty, and it can even wear the mask of science, but still be completely wrong underneath. Now imagine walking into a room where everyone speaks with absolute authority. White coats, serious faces, complex words flowing like clockwork. You would naturally assume these people understand everything they are talking about. That assumption feels safe, comfortable, even necessary. But what if that comfort is the first illusion? What if the difference between knowing and understanding is so wide that even highly trained minds sometimes stand on the wrong side of it without realizing? Because here's the uncomfortable possibility. The human body is not a simple machine, and medicine is not a finished story. It is an evolving investigation into something far more complex than any single mind, or even generations of minds, can fully grasp. And yet, we behave as if it is all neatly solved. We trust labels, we trust routines, we trust confidence in speech, but very rarely do we stop and ask the simplest question of all. Do we truly understand what is happening beneath all these explanations, or are we just repeating systems that already exist? There is a thin line between expertise and illusion, and sometimes that line is invisible until someone dares to question what everyone else quietly accepts. Because the moment you strip away the jargon, the protocols, and the familiar patterns, something fascinating begins to happen. The certainty starts to shake. The explanations start to thin out, and you are left standing face to face with something far more honest, uncertainty. But this is not a story about ignorance. It is a story about awareness, about the hidden gap between what we say we know and what we actually understand, about how intelligence can sometimes become a cage when it stops questioning itself. And once you see this gap clearly, you cannot unsee it again. So the real question is not whether experts are right or wrong. The real question is, how deep does understanding actually go when you remove the safety of memorized knowledge? And to explore that, we have to go far beyond what is obvious. The difference between memorization and understanding is one of the most subtle and yet most important distinctions in all of learning, especially in a field like medicine. Memorization is the ability to store and recall information, lists of symptoms, names of diseases, protocols, drug interactions. It gives the appearance of mastery because it allows someone to respond quickly and confidently. But understanding is something deeper. It is the ability to reconstruct knowledge from first principles, to explain why something happens rather than simply stating that it does. A person who has memorized that a certain drug lowers blood pressure may perform well in practice, but if asked how it interacts with receptors, what cascade it triggers, or why it sometimes fails in certain patients, the gap becomes visible. Understanding allows flexibility. It allows adaptation when conditions change, when a patient doesn't fit the textbook case, when something unexpected occurs. Memorization, on the other hand, is brittle. It works perfectly until reality deviates from the script. And in medicine, reality deviates all the time. The human body is not a standardized machine. It is a dynamic system with countless variables. So when someone relies purely on memorized knowledge, they are navigating a complex world with a rigid map. It may guide them often, but it will inevitably fail in situations that require deeper insight. True understanding means you can rebuild the map when it fails, because you know how the terrain itself works. The illusion of expertise grows naturally out of this reliance on memorization and structured learning. Society tends to equate credentials with understanding. Years of study, degrees, titles, and professional language all contribute to an aura of authority. When someone speaks with confidence and uses specialized terminology, it creates a psychological effect. People assume depth where there may only be surface-level familiarity. This is not necessarily intentional deception. Often, the expert themselves believes they understand more than they actually do. This is because the system rewards correct answers rather than deep explanations. If a doctor gives the right diagnosis and prescribes the correct treatment, the process is considered successful, even if their conceptual understanding of the underlying mechanism is incomplete. Over time, this reinforces the illusion. The expert becomes skilled at navigating known patterns, which further strengthens their confidence. But when confronted with unusual cases or fundamental questions that strip away the layers of terminology, the limits become apparent. The illusion is not that experts know nothing, but that they may know less than they think, especially when it comes to the foundational why behind what they do. This illusion can be dangerous if it discourages questioning, because it creates a culture where authority replaces inquiry. First principles thinking offers a way out of this trap by forcing a return to the basics. Instead of relying on established frameworks and accepted knowledge, it asks a simple but powerful question: what do we know to be fundamentally true, and how can we build from there? In medicine, this means going beyond protocols and guidelines to examine the underlying biology, chemistry, and physics. It means understanding how cells function, how molecules interact, how systems regulate themselves. When someone thinks from first principles, they are less likely to be misled by tradition or assumptions. They can analyze new situations more effectively because they are not limited to pre-existing categories. For example, rather than memorizing that a certain symptom corresponds to a specific disease, they can analyze the symptom in terms of physiological processes and consider multiple possibilities. This approach requires more effort and more curiosity, but it leads to a deeper and more flexible form of knowledge. It also exposes gaps in understanding more quickly, because it demands clarity at every step. If you cannot explain something from the ground up, then you do not truly understand it. First principles thinking is uncomfortable because it removes the safety net of established knowledge, but it is also liberating because it allows genuine discovery. The complexity of the human body is one of the main reasons why even highly trained professionals struggle to achieve complete understanding. The body is not just complicated, it is complex in a way that defies simple cause and effect explanations. Multiple systems interact simultaneously, feedback loops regulate processes in real time, and small changes can have unpredictable consequences. For instance, a hormone released in one part of the body can influence multiple organs, each of which may respond differently depending on context. Genetic variations, environmental factors, lifestyle choices, and even psychological states all contribute to how the body functions. This means that no two individuals are exactly the same, and no treatment works identically in every case. Medical science attempts to manage this complexity by creating models and averages, but these are simplifications. They are useful, but they are not complete representations of reality. As a result, there is always a gap between what is known and what is actually happening inside a living organism. This gap is where uncertainty resides. It is also where curiosity should thrive. Instead of pretending that the system is fully understood, acknowledging its complexity encourages continuous investigation. It reminds us that every answer is provisional, subject to revision as new information becomes available. The role of curiosity and skepticism is central to pushing beyond the limits of current knowledge. Curiosity drives the desire to ask questions, to explore, to challenge assumptions. Skepticism ensures that answers are not accepted blindly, that evidence is examined critically, and that conclusions are tested against reality. Together, they form the foundation of scientific progress. In medicine, this means not only following established practices, but also questioning them. Why does this treatment work? In what cases does it fail? Are there alternative explanations for this symptom? These questions are not acts of defiance. They are acts of engagement. They reflect a commitment to understanding rather than mere compliance. Without curiosity, knowledge becomes static. Without skepticism, it becomes dogma. The balance between the two allows for growth while maintaining rigor. It also creates an environment where uncertainty is not seen as weakness, but as an opportunity for discovery. When professionals are encouraged to question and explore, they are more likely to uncover new insights and improve existing practices. This requires humility, because it means accepting that current knowledge is incomplete. But it also requires courage, because questioning established norms can be uncomfortable. The limits of scientific knowledge are an inevitable consequence of the complexity of the world we are trying to understand. Science is a method, not a final destination. It provides tools for observation, experimentation, and reasoning, but it does not guarantee complete answers. In medicine, this is particularly evident because the subject of study is a living, evolving system. New diseases emerge, old ones change, and treatments that once seemed effective may lose their efficacy over time. Research continuously adds to the body of knowledge, but it also reveals new questions. Every discovery opens the door to further uncertainty. This does not mean that science is unreliable. It means that it is dynamic. Its strength lies in its ability to adapt and improve. However, this dynamic nature can be misunderstood. People often seek certainty, especially when it involves health and well-being. They want clear answers and definitive solutions, but the reality is that medicine operates within probabilities, not absolutes. Treatments are based on the best available evidence, but they are not guaranteed to work in every case. Recognizing this limitation is important because it shapes expectations and encourages ongoing inquiry. It also highlights the importance of communication, as professionals must convey both what is known and what is uncertain. When these ideas are brought together, a broader picture emerges. Memorization without understanding creates a fragile form of knowledge. The illusion of expertise can mask this fragility and discourage deeper inquiry. First principles thinking offers a way to rebuild knowledge on a more solid foundation. The complexity of the human body ensures that complete understanding remains out of reach, making curiosity and skepticism essential tools. And the limits of scientific knowledge remind us that the pursuit of understanding is an ongoing process, not a completed task. This perspective does not diminish the value of expertise. It reframes it. True expertise is not about having all the answers, but about knowing how to find them, how to question them, and how to refine them over time. It is about being comfortable with uncertainty while striving for clarity. It is about recognizing that knowledge is not a static collection of facts, but a living process of discovery. In this sense, the idea that doctors, or any experts, might not fully understand everything is not a criticism, but an invitation. It invites a shift from certainty to curiosity, from authority to inquiry, from memorization to understanding. It encourages a mindset where questions are valued as much as answers, and where the goal is not to appear knowledgeable, but to become genuinely informed. This shift has implications beyond medicine. It applies to any field where complexity and uncertainty are present. It challenges the way we think about education, expertise, and progress. It suggests that the most important skill is not the ability to recall information, but the ability to think critically and ask meaningful questions. And perhaps the most important realization is that this process never ends. No matter how much we learn, there will always be more to discover. No matter how confident we become, there will always be deeper layers to explore. This is not a limitation to be feared, but a reality to be embraced. It keeps the pursuit of knowledge alive. It ensures that progress continues, and it reminds us that understanding is not a destination, but a journey that unfolds with every question we dare to ask. In the end, what we are really looking at is not a failure of medicine, and not a failure of the people who dedicate their lives to it, but a deeper truth about human understanding itself. We build systems, we collect knowledge, we refine techniques, and yet reality always stays one step ahead of us. The human body continues to reveal new layers, new complexities, new surprises that refuse to fit neatly into any final explanation. And maybe that is the most important realization of all, that understanding is never a finished product. It is not something you possess completely, but something you keep working toward, question by question, mistake by mistake, discovery by discovery. The moment we assume we already know enough, we quietly close the door to progress without even noticing it. True wisdom is not about claiming certainty in a world that is uncertain. It is about staying curious in a world that constantly challenges what we believe. It is about being willing to admit that even the most confident answers might still have deeper questions hidden inside them. So instead of treating knowledge as something fixed, we learn to treat it as something alive, something that grows, shifts, and improves only when we continue to question it. That is where real progress begins, not in absolute answers, but in better questions. And if there is one thing to take from all of this, it is this: never let the appearance of understanding replace the effort of truly thinking. Good luck on your journey of learning, questioning, and exploring deeper truths. And thank you for your time, your attention, and your curiosity until the very end.